My name is Ashley Moorfield, and I will be doing an informative speech on Alzheimer's disease. Do you have a loved one suffering with Alzheimer's disease and need help understanding it and how to help? Well, I can help. I know a lot about this disease, and I work in the healthcare field with these types of patients. And I have my own personal experience with these patients. The main idea is to inform you about the effects it has on the brain and the complications that come with the disease. I will inform you about what Alzheimer's is and the signs and symptoms of the disease. Also, you will learn about the causes of the disease and how the family can help and the treatment. I will then talk about the different kind of physicians that specialize in the disease. Alzheimer's is the sixth leading cause of death in America, and more than 5.4 million Americans are living with this disease. Alzheimer's disease is a common form of dementia and is a group of brain disorders that cause progressive loss of intellectual and social skills. It is diagnosed in people over 65 years of age, and it causes brain damage that gradually gets worse. There are many symptoms that are associated with this disease, such as memory loss, decrease in thinking and reasoning skills, wandering, and aggressiveness. A patient may not know their family members if they have lost their memory. They can't think for themselves anymore, and most of the time the patients with Alzheimer's disease is in a secured unit. And they are normally aggressive with the caregiver because they don't know who they are or what they are doing, and they think they are trying to hurt them. It is important to tell the patient what you are doing so you do not frighten them, because they could become aggressive if they are scared. Also, the diagnosis of this disease requires medical evaluation of the patient. Many doctors are still trying to fully understand the disease. They believe it comes from genetics and environmental factors. Alzheimer's disease affects many parts of the brain. The area of the brain it affects is the frontal lobe, which governs the person's intelligence. It also affects the temporal lobe, which controls the memory, and the parietal lobe, which controls the language that the person speaks. Some patients with Alzheimer's disease that speak two different languages will sometimes convert back to their native language. There is a difference between a healthy brain and an affected brain. In an affected brain, there is a massive loss of production of cells, which causes the brain to shrink. With Alzheimer's disease, there are some requirement of hospitalization or medical care, such as living in an assisted living facility, receiving home health care, or a nursing home. There is currently no treatment for Alzheimer's disease, and there is only medicine that can slow the process down. When dealing with Alzheimer's disease, it is important that the patient goes to the right physician. There are certain physicians who specialize in the disease. A neurologist is a medical doctor who is trained in diagnosing the treatment of the nervous system. A geriatric psychiatrist specializes in the diagnosis and treatment of mental health issues in elderly patients. A geriatrician is a medical doctor who has additional experience in assessing and treating problems that are common in the elder. A gerontologist is a health professional who specializes in working with the elderly. I also want to talk about what the family can expect from the cost of the patient. The family can expect this disease to be expensive. The loved one not knowing them, confusion, behavioral problems, grief, loss, and depression. There are certain behaviors that the family should expect from their loved ones, such as suffering from depression, anxiety, mood swings, wandering aggressiveness, distrust in others, and changes in sleeping habits. The cost of dealing with a family member with Alzheimer's disease when putting them in an assisted living facility is about $5,000 a month. This doesn't include extra costs such as hygiene and food products. Many patients are enrolled in Medicare and disability insurance. I hope I gave you a clear understanding of what Alzheimer's disease is and how serious it can be, and many of the complications associated with the disease. Alzheimer's disease is a form of dementia that causes serious problems with the brain. The difference between a healthy brain and an affected brain is a massive loss of cell production. There is also certain doctors a patient with Alzheimer's disease can see. It is important to know about this disease, especially if a loved one is suffering from it. Alzheimer's is an intimidating and threatening disease. Possessing the knowledge I have given you, I hope I gave you an advantage in being a preventable measure to this disease. And here is my audience.
Okay.